Hello, everyone. Welcome. Thanks for tuning in. I'm Ann Decter. I'm the director in community initiatives here at the Canadian Women's Foundation and part of the team that will be attending the UN Commission on Status of Women in March in New York. Just to do a little housekeeping at the beginning, we're going to take questions after the presentation is finished. If you have a question, you can let us know by pushing the raise your hand button or by letting us know by writing something in the chat, and then we can get to you. So I want to welcome Katherine Scott, who has kindly agreed to present for us today. She is Director of Gender Equality and Public Policy at the Canadian Centre for Policy Alternatives, and she is going to educate us all today on social protections, a gender lens on income security and poverty reduction. And for many of us, that's in preparation for attending the UN Commission on Status of Women this year, the theme of which is social protection systems and gender equality. So over to you, Katherine.
Thanks so much, Anne. Hang on, I just need to, oopsie. Oh, just a minute. Yep. Sorry, I thought the screen. There we go. Slide, and there we go. All right, can everyone see the slides up on the panel?
Yep, it's perfect.
Yes. All right, that's great. Thanks so much. Thanks so much, and thanks to Anne for inviting me to present this webinar today. It's a real privilege, and I'm very excited about your trip to New York to tackle social protection and challenges that we're all facing, certainly in Canada and around the world. I'm sure it'll be a very exciting meeting. I'm Katherine Scott, and as Anne said, I work at the Canadian Centre for Policy Alternatives, an organization some of you may be familiar with. The CCPA has been around since 1980. We're a national nonprofit research institute that's focused on issues of social, economic, environmental justice, supported by roughly 12,000 members across the country. We have offices actually across the country in several provinces, as well as in Ottawa, which is where I'm based. We have a long-standing interest and research program on issues of gender equality in Canada, and I am the researcher in charge of the Making Women Count program, which we've run for several years now, and the principal author behind the Best and Worst Place to be a Woman in Canada, which actually I can give a shout out. The next edition is due in a month's time around International Women's Day, which examines the gender gap in 26 cities across the country. So hopefully you can look out for that. Today, though, as Anne said, we're going to be talking about social protection systems and in preparation for the trip to the Commission on the Status of Women in March in New York. So, all right, is this working? Oh, there we go. All right. As I said, this presentation is going to be on women and income security programs. The Women's Foundation is hosting this webinar in order to provide some context for the upcoming session at the UN. As Anne noted, the session's looking at 3 topics, in particular social protection systems, access to public services, and sustainable infrastructure, and their implications of the implications of all 3 for gender equality and the empowerment of women and girls. Investments in these areas are key to achieving the goals set out in the Beijing Declaration and Platform for Action, as well as the 2030 Agenda for Sustainable Development, as the realization of women's rights depends crucially on the availability, accessibility, affordability, and quality of public services and infrastructure, as well as the universality of coverage and adequacy of social protection. In this presentation, I'm going to be focusing on social protection systems, which is the first of the CSW themes, and provide some context on Canada's social safety net, recent policy reforms, and where women fit into this picture. So the key question that I'm looking at, or certainly that inspired my thoughts on for this webinar, was do Canada's social protection systems protect women? Where are we today? And what's needed to advance gender equality and women's empowerment. There we go. So first off, just to get definitions out of the way. This presentation looks at social protection systems. The CSW uses this term, social protection, to refer to policies and programs designed to reduce and prevent poverty, vulnerability, and social exclusion. By that, they mean or are referring to different social protection or systems or schemes that provide protection across the life course, including child and family benefits, maternity protection, support for the unemployed, sickness benefits, old age benefits such as OAS and GIS here in Canada, as well as access to affordable health care. In Canada, though, we don't tend to use the term social protection systems so much. Rather, it's much more about social safety net, income security supports, welfare state programs. Those terms are much more commonly used. So I'll be referring to them interchangeably throughout this report. And I should note before I get into the presentation that I'm really happy to take questions if somebody has a question right away. So, you know, at the end of a section or so forth, but they can pop up and perhaps one of the organizers can just raise the flag or interject at that point, just in case. So we can wait till the end, but do please note your questions as we go, because I'm looking forward to the Q&A at the end. So this here, just to start off, here's the definition that the UN is using and how I'm going to be referring to it in the presentation. So starting off, Canada, social reformers, certainly looking back many decades, social reformers in post-war Canada built our social safety net, or a system of social protection, to insulate citizens from the power of the private market that was so graphically illustrated through the Depression years. The risk or threat of income interruption due to old age, sickness, disability, widowhood, and unemployment were the key drivers behind the development of Canada's welfare state. And certainly the mass poverty and destitution that was evident through the Depression really spurred reformers of the day. It should be noted very clearly that it was never the intent of the framers of Canada's welfare state, or the builders of Canada's welfare state, to create an alternative to the private market or to the family as the primary source of social welfare, but rather their goal was to create a safety net for those who could not, for reasons deemed acceptable to them, participate in paid employment. So very much this was to supplement or support families in need, but certainly not to usurp the private market or the family as the principal method through which, or primary source for social welfare, for which we took care of ourselves. The vision certainly was that individual families headed by gainfully employed fathers were expected to make their own way, accessing support only if and when needed, and if and when deemed acceptable. By the mid-1970s, skipping forward 40 years, through that period, most of the pieces of what we know as Canada's welfare state today were in place. And here, this would describe certainly the social programs with which we're all familiar. It's a patchwork of certainly health and social services, provincial health care and the like, demogrants such as family allowance, which has been transformed since, social insurance plans such as the unemployment insurance, as it was called then, it's today called employment insurance, CCP, Canada Pension Plan, workers' compensation, these are all contributory programs that we have in Canada, as well as many different means-tested and income-tested programs. And here we have social assistance, children's benefits, the guaranteed income supplement for seniors that people are familiar with. So these are the different types of programs that we are loosely assembled in Canada's social safety net. By and large, Canada, along with other largely English or Anglo countries that in the Anglo umbrella, or along with such as the UK and the US, were generally described as liberal welfare states. This means these are particular welfare states where there is a clear division in the generosity and intent of contributory programs such as EI and CPP, and last resort or residual programs such as social assistance, those intended for the poorest of the poor. So what this means comparatively is that in Canada, our programs tend to provide low levels of benefits and low wage replacement rates compared to many other high-income countries. And the example here, for instance, under the EI program, the insurance, that program insures for 55% of earnings. That's true for EI, maternity benefit, and parental leave, so comparatively low by international standards. Our programs also afford governments considerable discretion in determining an eligibility and in placing conditions on receipt of benefits. So a program like workfare, where paid employment is necessary in order to access benefits in the first place. And this is compared to other systems where access to programs is considered a right of citizenship. Our programs also tend to encourage individual and private savings through vehicles such as RESPs and RRSPs. That's registered education savings plans and registered retirement savings plans. These types of vehicles or programs have largely benefited upper income Canadians who have the resources to sock away in the first place at the expense of investments in programs that target lower income Canadians. They also provide lots of income to our financial service sector, but that's a side point. And lastly, our public programs also provide little by way of support for childcare and elder care, relying hugely on the unpaid labor of women and their families, as well as private market alternatives. So that's a description loosely of the characteristics of our liberal welfare state. So as I mentioned off the top, or from that description, our programs basically have been designed to provide a basic level of protection against the risk of poverty. Stress on the word basic. And predictably, there are large and significant gaps regarding the extent of coverage and the level of benefits on offer. Large cuts to welfare state programs through the 80s and 90s further undermined Canada's social safety net. Between 1992, for instance, 1992 and 2002, for instance, total Canadian government spending fell by 10 percentage points of GDP, the highest cuts of any OECD country over this period. Federal program spending alone fell from 15.7% of GDP in 1993 to 11.7% of GDP in 2004. This represented a cut of almost $50 billion. Federal program spending has continued to decline in the past 15 years, and it opened the door to significant tax cuts by the Harper government that they pursued through their 9 years in government. This description, and it will come as no surprise, having presented some of this information, means that Canada is technically a very low spender by international standards on welfare state programs. And I've just put this slide or pulled it up from the latest research from the OECD that shows where we rank in among OECD countries in terms of the generosity and level of public spending on social programs in Canada. In 2016, we see the average for social spending across the OECD, that's the blue line in the middle, was 21% of GDP. And it ranged from a high of France over here at roughly 32% of GDP to a low of 6.4% in Mexico. Canada ranks 27th out of the 35 countries on this indicator with social spending to GDP ratio of 17.2%. There we go. Switching gears now. So over the past 25 years then, in addition to cost cutting, both levels of government have also carried out a variety of different reforms to programs and different patterns of welfare state reform, focusing largely on anti-poverty programming as well as healthcare. Looking at anti-poverty programs then, which is the focus of the session in New York, reform efforts have largely been focused on reducing uptake of income support programs by encouraging and/or compelling clients of different programs to take up paid employment. This is, oopsie, sorry about that. Oops. Lost my track here. This has involved, has been done by redesigning programs to enhance work incentives and imposing stricter eligibility requirements on programs. For example, the discussion that's going on in Ontario today with the disability support program is introducing much tighter restrictions or definitions of the definition of disability in order to access benefits. Benefit levels as well have been trending down as a result, more often than not, of the failure to index to the rate of inflation. So this whole suite of different reforms, which have created a much more tightly focused, tightly targeted programs to those with very low incomes and or with very high levels of disability, for instance, as well as offering up lower levels of benefit. I guess the classic example would be as well reforms to the EI system in the mid-90s, which many people will be familiar with. At that time, under the Chrétien government, and they introduced a set of changes that are still in place today, which changed up eligibility requirements for the system to an hours-based system. The net outcome of which was coverage levels for unemployment insurance have been driven down to historic lows. Today, only 40% of the unemployed receive benefits, which is a rate much lower than those, and a rate that's much lower in Canada's largest cities. In terms of other types of reforms that have in terms of pursuing increased targeting of different income programs, we see that different provinces as well have been introducing a different suite of programs designed to make work pay. These include offering up additional support specifically to low-income workers to encourage people, for instance, including social assistance recipients, to take up low-wage employment. So this would include things like limited support for childcare, dental benefits, and the like, prescription drugs. Again, making it more tenable to take up low-wage employment and to leave welfare. At the same time, I think it's really important to add that there's actually been very little effort taken to tackle the conditions of employment in the low-wage labor market, such as minimum wage levels, limited access to employment benefits and skills training, or adequate employment protections for instance, temporary contract or migrant workers. Indeed, here in Ontario, we're looking where there actually were gains in the last 2 years. We're looking at significant rollback of employment standards right now under the Ford government. The other important theme, and I think it's important from a feminist lens perspective to take in and discuss, and it'd be interesting how people see this, is that one of the current themes, and I think this dates back certainly to the late 90s, is that investment in children has been a very important theme. And it's been attached to what has been called largely as social investment strategies that governments have pursued, specifically to enhance human capital and to improve economic productivity. The announced goals of privileging or focusing on children are to increase social inclusion, to minimize intergenerational transmission of poverty, and to prepare populations for to prepare today's population for today's labor market. But the idea here is that social spending should not just insure against misfortune, but should invest in people's capabilities and their potential. These investments indeed should reap rewards for the future. Children and child poverty have been a key focus here, as reflected in enhanced children's benefits, as well as investments in expanded childcare services, parental leave, and the like. I think it's worth pointing out here that certainly there have been investments in these programs, but still, certainly governments in Canada, with the notable exception of Quebec, continue to provide very low levels of support to families compared to governments elsewhere, and that access certainly to parental and family leave remains very limited to those who are self-employed, precariously employed, or low-wage workers. There we go. Anyway, at this point, you'll be wondering why I'm not talking about women or gender equality. My thought was I would lay out sort of a description of Canada's welfare state and the types of directions and reforms we've been pursuing in the last while. But the question now is, coming back to the top, where do women fit into this picture? Certainly, the welfare state and social security programs are very important to women's well-being. In Canada, 2.4 million, or 12.7% of all women and girls, live in poverty. This as measured by Canada's new benchmark for poverty, the Market Basket measure. looking deeper, some groups of women have much higher rates of poverty and are more likely to be poor than others. I pulled up some of this information from the last census using the MBM, and we can see here that 17.8% of Indigenous women and girls are poor. This is information for 2015. Among racialized women and girls, 1 in 5 is poor, lived in poverty in 2015. The rate for is 23% of women with disabilities. Recent immigrants, almost one third of all recent immigrants to Canada, those who emigrated between 2011 and 2016, were poor. As well here, women with low levels of education also face a very high risk of poverty. The other point I wanted to stress is that women rely on income supports to a greater extent than men. So these programs, these programs are hugely important to their economic well-being. You'll see here on the chart on the bars over to the left that overall 75% of all women and girls reported income from government transfers in 2015 compared to 62.6% of men. Government transfers also made up a larger share of their income. On average, women claimed roughly $8,000 in government transfers in 2015 compared to $7,300 claimed by men. And you'll notice that the difference, if you move over to the group among those aged 25 to 64, is even greater. So 71.3% of all women in this group claimed to benefit compared to only 54%, or just roughly over half of all men at 54%. Lastly, I wanted to raise some information about why it's so important and to state unequivocally that income security programs do make a difference, even those in Canada, which are not particularly generous. This is research-based from StatsCan, looking at poverty rates using the low income measure after tax, which is slightly different than the ones I presented from the census. It shows that, in programs such as old age security, senior child benefits, and unemployment insurance among younger people do actually reduce rates of poverty for both men and women. So in 2016, the poverty rate for women would have been 30.2% without transfers. That is, if we had calculated it based on market income or employment income alone, rather than the 13.8% that's reported. So that's a difference of 16.4 percentage points. That's a very significant difference, and it's particularly important, as you'll see, income security programs for women, certainly for older unattached women. You'll see down at the bottom the very high rates of poverty that are reported. Those are the dark bars that if you calculate rates of poverty based on market incomes alone. For senior women, actually, it would have represented 75.6% rate of poverty for unattached senior women as compared to the 34%, a still very high 34% of older unattached women who are poor, who are in receipt of government benefits. So income supports do make a difference. So looking at the question then of gender inequality. Does Canada's system of protection advance gender equality? The data that we've just seen illustrates the critical importance of the social safety net to women's well-being. But as in the past, today's programs still reflect and reproduce gender inequalities in their design and implementation. Unlike policies of the post-war period that were blind to their gender impact or ignored it altogether, more recent social investment initiatives are gender aware. That is, take gender, acknowledge gender in their design and implementation. However, the needs of adult women and gender equality goals more broadly have been largely lost in this debate. Women's economic contribution as well as their care work are on the agenda, but not the structural factors that cause women, their work, and their achievements to be devalued and undervalued with respect to men's. And this despite decades of feminist mobilization and analysis. I would argue that today, equity is seen as a means to an end, for instance, greater economic productivity, but not as an end in itself. And this despite So despite excellent diagnoses, a diagnosis of gender disadvantage, analyses that many of us have all generated, I would argue, or I see, that equality is rarely the explicit goal of policy. The discussion tends to turn on the barriers that women have faced, that result from acknowledged inequalities. There tend to be a few strong policy prescriptions on offer, and invariably employers and governments are asked to try harder, to lean in. But in the end, we see that welfare state programs continue to respond poorly to today's employment and caring challenges. The reforms, or current reforms, are principally designed to enhance the ability of all individuals, regardless of position or circumstance, to engage in paid labor. This despite the narrative about reaching one's full potential notwithstanding. As a result of this singular focus and the absence of substantive investment, there remains a significant gap in the types of support on offer that would facilitate the participation of women in paid labor and support caring labor more equitably. For some, the expectation that women serve as unpaid caregivers is used to justify the lack of public support for home care, child care, case management, and the like. So this ultimately is the difference between talk and action. At this point, I think we need to segue then to the current federal government and the current context of the last number of years since 2015. This is a government, our federal government, that is explicitly branded and acknowledged itself or stated itself to be a feminist government. It has certainly taken concrete steps to raise the profile of gender disparities and introduced new tools to assess and track progress. It's made important investments in child poverty, childcare, and violence against women programming. It's started the work of redress for historic and continuing wrongs against Indigenous women, and it's increased funding for women's organizations, all of which, I would argue, will make a real difference in future public policy and hold out the potential of making a difference in women's lives. But important initiatives such as these demand substantive direction, action, and resourcing. By way of example, I wanted to look at a couple of current policies or recent policies that were introduced this past fall to capture some of the dilemma or the dilemma that we're currently in, looking at the federal government's feminist agenda. The Budget Implementation Act, Bill C-86, was introduced and passed in the fall. It included legislation for the new status of women in Canada, now called Women and Gender Equality Canada. Also included legislation mandating gender-based budgeting and the long-awaited proactive Federal Pay Equity Act. The new department, as WAGE it's called, will ensure, for instance, that the federal government's actively engaged in supporting women's rights and gender equality through its own policy work and research, as well as will serve as a critical support for women's organizations across the country. The Gender Budgeting Act will require governments of the day to assess and report on the impact of all new budget measures, including proposed revenue generation and program expenditures, using a gender lens and diversity lens. And lastly, the introduction of proactive pay equity legislation will help chip away at Canada's stubbornly high pay equity gap and uphold women's right to equal pay for equal work. These are foundational pieces for a more inclusive and more just and prosperous country. At a time when there's mounting backlash, these efforts are significant and important to ensure, as noted in the preamble to the proposed legislation for the new department, that all, quote, have an opportunity equal with others to make for themselves the lives they are able and wish to have, end quote. However, the work of the new department and those charged with carrying it out will require sufficient resources to ensure its positive impact within government and in communities. This includes mechanisms for meaningful engagement with and support for women's rights and gender equality seeking groups. On this, I should say the CCPA is on record as recommending an annual budget target of $100 million per year for Status of Women or WAGE Canada. As well, the new Pay Equity Act will also hinge on resourcing available to the new commissioner for training, education, compliance, and enforcement. There's much work to be done then to ensure, given the current state of the Act, to ensure that its many shortcomings are addressed through the upcoming the period to develop regulations this upcoming year. I thought I'd just segue and provide a short segue, because it captures some of the dilemma I think we're all facing looking at the government's feminist agenda in a similar kind of set of considerations that we bring to bear looking at the new Poverty Reduction Act. This act also was introduced in the fall, and it outlines specific targets for reducing poverty in Canada as measured against a new official poverty line, the market basket measure. And it also establishes a framework and a process for reporting on progress to each House of Parliament. At the same time, though, like the initiatives above, it doesn't include any new investment in the programs needed to achieve the strategy's goals. Indeed, Canada's new anti-poverty plan is more of a framework to accelerate poverty reduction rather than a strategy. A strategy, for its part, implies a plan to get from where we are to where we want to go, and crucially, the resources to back it up. And on this score, Canadians are still waiting. You'll see from this is a checklist actually that the Dignity for All campaign composed, looking at the Opportunity for All plan that was released by the government last August. And indeed, what they asked for and what we got. They're still, as I noted, low-income Canadians are still waiting. A more effective poverty reduction plan requires ambitious targets and timelines. It requires greater investments in programs such as universal childcare, national pharmacare, and training and education for marginalized workers, key issues for women everywhere. So, where are we? Women are still waiting. It's no longer 2015, it's 2019, and the 2019 election is around the corner, and I think it will be a telling bellwether as just how deep the political will is to keep moving on tangible, impactful policy that will address persistent gaps in women's personal and economic security. To truly close the gap for women living in Canada, we need sustained action. We need better funding for women's organizations. We need policy that targets discrimination against Indigenous and racialized women, women with disabilities, and gender diverse peoples. And we need decision makers willing to put in the long-term work necessary to achieve lasting change beyond the next election cycle. I think the 63rd section of the Commission on the Status of Women is a great opportunity to raise many of the points I've raised here and to advocate for change that will strengthen social protection for women in Canada. And I wish the team good luck with this important work in New York. And I hope that the presentations provided some context for your discussion and some insight as well. I'm certainly happy to share my slides and to follow up with anyone personally to talk about the research at CCPA and the points I've raised here as well. So I'll turn it back to the organizers for questions.
Hi, everyone. It's Keitha Mercer here. I'm a staff person at the Canadian Women's Foundation who will also be on our UNCSW team. So we have about half an hour for a discussion. I know there's some folks on the line who are part of the UNCSW delegation that the Canadian Women's Foundation is going with, and I see a few people who are parts of other delegations. So if there are folks who would like to talk a bit about your strategy or what your delegations will be working on down in New York, we'd love to hear it. Otherwise, if there is anyone who has points about social protection systems in your work that you'd like us to know about, we're happy to hear that too. And yes, we will be sharing the presentation with participants afterwards. So you have a couple of options. You can put your questions in the question box, type them in, and we will read them out, and Katherine can answer them. Or if you have a mic and would like to say anything out loud, we're happy to unmute you.
Sorry, I know that was a long discussion. Lots of things raised.
Hi, I have a question, or I'm interested in your comment. One of the challenges, I think, is when provincial legislation is contrary to federal legislation. I think Ontario is a really good example of that, of the Ford government rolling back some of the advances that have been made. That I think is a challenge, and I'd just be really interested in your comment or thought about that.
For sure. This time in Ontario, I know we're based in Ontario, and it's certainly, I guess, in these early months of the Ford government, it's overwhelming to pick up the newspaper every day and to see the changes that have been announced and what kind of impact they'll have. Certainly last week, for instance, the changes to tuition, and that will hugely impact low-income students and low-income families. This is the perennial challenge in Canada, and the UN actually has called on Canada time and again in its many reports to better coordinate federal and provincial action, because we do have the situation in Canada where you can have what appears to be progressive change federally or investments federally, and then you turn around provincially and you'll see, rollbacks in different policy areas. And I think, and even our federal provincial financial arrangements that are really important to the Canadian social policy, whereby the federal government puts out money to support provincial programming such as childcare, and we certainly have a new set of bilateral agreements. They put forward the money without conditions, such that a province could take those monies and nominally spend it on childcare, but roll it all into particular programs that really will not expand or enhance quality or universal access. This is a challenge. My comment, certainly, from a federal perspective, I've always been a believer that it's important to take bold action. We do live in a very decentralized country. In fact, I think Canada is one of the most decentralized in the world. I think movements have been the women's movements, women's organizations have been very astute and collaborating provincially and federally on related policy changes and supporting the efforts at different levels of government. Holding governments to account, for instance, childcare movement's a great example about the money that's put on the table, inadequate though it is by the federal government, to how the provinces are taking it up and using that money. But I agree, it remains a really persistent problem, and it's a mystery to me. It's a mystery. It really is a stumbling block to effective welfare state reforms that would really move the yardstick forward in different areas. I'm sorry, that just reinforces your point that this is a huge challenge, coordinating, when the right hand and the left hand are not necessarily moving in the same direction at one time.
We have another question. Leah, there you are, unmuted.
Yeah, so thanks. That was a really interesting presentation. My question is regarding immigration policy, because I work with migrants, refugee claimants, and non-status women.
Yep.
And so obviously there's a lot of exclusion of these groups of women, but I'm curious to know if the framework of social protection would include immigration policy, because often where I work, we're advocating for immigration policies that would better protect migrants. And so I'm just wondering, does that enter into this idea, or is this the idea of social protection much more centered around kind of like the economic advancement of women?
Certainly, and as I understand it, and I'm not an expert certainly on how the UN systems per se, the UN social protection, the idea focuses on poverty and prevention of poverty, and it certainly does, certainly through the different conventions, focus on the specific and unique needs of migrant workers and immigrants in different countries. So they're certainly, as my understanding is certainly captured. Programming that would support newcomers would be captured under social protection systems. Certainly it's an important dimension of the Canadian government, Canadian programs. And in many ways, there's a real disconnect between how we typically talk about social programs and we talk about immigration quite separately. And in fact, there's an important argument to be made in this very interconnected world that we need to see it much more holistically. But I do think, certainly for this purposes, social protection in the UN does certainly include the well-being of newcomers and migrants in the different member countries.
And as a policy, like if I was to do kind of an analysis, like, let's say using a social protections lens on immigration policy, for example, that would be appropriate.
Oh, I think so, for sure, because certainly access to social assistance, for instance, is a critical issue. It's on care, like policies that support caring are critically important. I know that certainly unpaid caregivers and access, migrant or temporary workers that are brought into Canada under the programs or the unpaid care or the caregiver program. Those are all critical pieces of Canada's welfare state. And I think increasingly we need to understand the interconnections between those because, clearly there are extraordinary disadvantages that many newcomer and temporary worker women working temporary employment and caring positions face. And, Canadian systems do not always even protect their rights. And in fact, it's a source of tremendous disadvantage between women as well. So I think that's wholly appropriate to see these, to link those two fields for sure.
Okay, great. Thank you.
All right, we have a question here from Chanel Granaway Mills. What advice do you have for women's organizations, funders, foundations, etc., to help move the dial from the talk and awareness of gender inequality to more action and resourcing towards gender equity?
Yeah, no, that's a great question. And, this is sort of the part of the discussion. I think it would be great to hear people's thoughts on this. It's a hard moment right now. It's, we've certainly, I'm up in Ottawa and there's a bit of a bubble around or a focus on federal government. I was clear. I think the government has made many important steps forward, under the banner of the feminist agenda, and certainly nominally tackled key long-term asks of the women's movement, such as pay equity. But when you sort of look at the pay equity legislation, and then in the preamble, there's a clause that says that that'll uphold equal pay for equal work, subject to business considerations. And there's no other human rights piece of legislation that has some proviso in the preamble that would say that the exercise of one's human rights was subject to business considerations. So, you're sort of struggling with, well, what is, the reform, the intent and the substance, what will be the specific impact on women down the road? So, of course, these are really important pieces of legislation, but what level of resourcing is attached to them? Do they actually tackle structural intersectional factors that generate women's inequality in the first place? And I mean, I would say sometimes not, or many times not. So, this is the moment we're in. And so what kind of advice to move that forward? Certainly, there's a group certainly of organizations that are working to raise issues like this during the next election in Up for Debate, which is a campaign for women's debate or a gender equality debate on election issues coming up for the next fall. I think certainly using the opportunities afforded to different women's groups for the first time in a long time to come together, to strategize, to support coalitions across different issues. I think we're in a position we can do that a bit better than we have been in the past, to reach out and make new alliances. I think that will certainly be important to pressing forward with a much, for more substantive policies and investments that really will move the dial on gender equality on any number of issues. I think the new, for instance, in childcare, I know the childcare movement's mobilizing right now. The new, the initial investments that were, agreements that the federal government negotiated with provinces and territories, for instance, are coming up, or they're due to expire in 2020. And hopefully the move is to try to get more substantive agreements in place for the next round that will hopefully direct investments to making, to building out a universal high quality system for all kids in Canada.
Okay, we have another question here from Pamela Uppel. They're wondering what your thoughts are on how you balance between critiquing the notion that gender equity is a mean to economic advantages versus gender equity should be a mean of itself when you're trying to work with the government.
That's right. And that's variation on the question before. It's in this particular political moment. There's no, and I myself as a researcher, we've all made, well, not we've all, I've made the argument certainly that mobilizing women's labor, for instance, unpaid labor, those who work in part-time and voluntarily, those who can't, will, certainly represent significant boost to our GDP. Certainly, that's an argument that the IMF makes. So we're in, we've made those arguments certainly to help broaden or expand the types of arguments we put forward as to why pursuing gender equality policies is obviously important to the realization of women's rights and their quality of life, but there's a business case for it as well. How do you square that circle? I think it's important to understand the scope and the impact of the policy choices that we make, and certainly understanding the economic impact is important to that, but it can't be the motivating factor, and that's the problem. And that's certainly what's happened then is you start seeing these economic arguments that are being picked up by institutions like the IMF and the World Bank and the OECD, and what's being lost, certainly as I argued, and others, certainly lots of other feminist scholars have argued this, what's being lost in that discussion is women's equality. And they're picking up this badge of honor and running forward, but you're looking at the policies and saying, well, what actually is happening? Women are being told to lean in. Well, that's not really going to do it, right? So women lean in. In fact, might be offended by that, but to work harder. Women obviously already work very hard, but sorry, I think it's important to generate different arguments, to use and tailor them to different audiences. I think that's important, but we can't lose sight of the fundamental rights that we're all involved in fighting for.
All right. Any other thoughts or questions? To answer a few questions and ones that anyone else might be having while Catherine's been talking, Katherine has kindly offered to share her slides, so we'll be sending them out after the webinar. And also, we're recording this webinar, so if any of your colleagues weren't able to make it that wanted to, we'd be happy to share the link as well. All right, we have another question from Pamela. They're asking, you mentioned we moved to an hours-based system under the Chrétien government. Do you know what the impetus was behind that?
It's funny. I actually remember attending hearings back in the day. This was all during the period when the Chrétien government first came in 1992, and they had launched their social security reform. Lloyd Axworthy was tasked with coming up with proposals on a whole range of issues, and the particular piece around EI. Of course, then the famous Paul Martin 1995 budget came down and whacked $7 billion out of transfers to the provinces, and for things like social assistance and healthcare. EI in that and at the same time, the proposals, the new EI system regulations came down. Partly, the context was right after the recession in 91, 92, and government officials were horrified by the run-up in, as one would expect through a recession, of people who needed to rely on unemployment insurance, as it was at the time, social assistance and the like, and it was very clearly tailored to trim eligibility to people that they were considered who had significant labor market attachment. So as a measure of those who had contributed to the system and such would draw benefit. I mean, the irony of this is, so all workers are required to contribute on their first $100 of earnings, but by bringing in a fairly high hours rate, at the time, many part-time and temporary contract workers will never have the hours necessary to make those claims, even though they are actually paying, and even though at the same time the government actually doesn't put a dime into the system. This is a program that's obviously all funded by employers and workers. Travesty upon travesty. So the hours was deliberately brought in, I think. What the pretext was that it would be more tailored to the labor market of the day, but really it was a cost. It was certainly done as a cost-saving measure to trim expenditures and to winnow off the employment insurance rolls, partly because there at the time, and still is the case, is that surpluses generated in that count are go to offset general government spending deficits and revenues. So that's a bit of a cynical take. And it's interesting because one of the first things the Trudeau government did was actually, the current Trudeau government, was to have a review of the unemployment insurance. And in fact, this government has introduced or taken away some of the changes the Harper government introduced on repeat users and the like. So they've cleaned it up, but they didn't tackle the hours and eligibility requirement, nor lower the level of hour, or lower to what certainly many advocates have been arguing for, a basic entry requirement of 360 hours. So that's still outstanding. And Minister Clos is currently considering whether they're going to do a more substantive review of EI. I suspect that won't happen in time for this election. Before the election, I guess if they are returned to office, he may pursue that, or the government may pursue that. But really the push to open up EI and to create a more equitable and fair system is really hugely important, because it grossly underserves people who are precariously employed, and many, many women. It's very biased against women. And this, of course, is important for those trying to claim parental leave and maternity benefits as well.
All right, we have time for one or two more questions if anyone has them. So I'll give folks a second to think of them and type them in if you have a burning question left to ask Katherine. But in the meantime, I want to thank you very much, Katherine, for this webinar. It was really helpful. As you said at the beginning, social protection is not a theme or not a term that we use a lot in Canada. So it was definitely a priority to talk about it for folks engaging in UNCSW this year.
Thank you.
And this was a very helpful webinar in terms of breaking it down and connecting it to our work.
I didn't put up my last slide, but my email address is on the last slide if people want to see it. So.
Oh, perfect. So thank you so much for taking the time this afternoon to give us a quick overview. I'm sure we can dive deeper on any one of these topics.
Yes, I know it's a huge topic. And lots of recommendations. I was reading some of the documentation. It's going to be quite interesting to see how it all rolls out in New York. So
yes. So we'll be more than happy to share the documents as they get released. I know that a few of the New York documents reports have been put together, and more coming as always. And I know our delegation and other delegations will be tweeting and blogging about what the Canadian government is saying down in New York. Right. So we'll be happy to share that too.
Perfect.
So thank you everyone for attending. As I said, we'll share the recording and the slides, and we look forward to talking to you all more and seeing some of you in New York.